We are going to be putting a huge focus on lung cancer awareness. We have one of our experts and friends in the studio now to talk about the importance of early detection. Thank you so much for stopping by. I'll let you introduce yourself.
Well, I'm Adrian DiVittorio. I'm
Yes.
a pulmonologist at Diagnostic and Medical.
Okay.
And I spend a lot of my time dealing with lung-related diseases, and today we're obviously here to talk about lung cancer.
So when we hear lung cancer, typically people will say, well, I don't smoke, so that doesn't affect me. And that's not necessarily true, right?
Correct. Up to 20% of lung cancer diagnoses do come from non-smokers or former smokers. So any time that somebody has smoked, that risk has increased. Secondhand smoke, family and genetics have a lot of role to it. But the absence of smoking, unfortunately, is not a clean slate for it.
So how much of a problem is this locally?
So locally and in the United States, it's a huge problem. If you take lung cancer, it is more prevalent and certainly more lethal than breast cancer, colon cancer, and prostate combined, and approximately 1 in 18 people will be diagnosed with lung cancer in their lifetime.
Now, we talked about the importance of early detection. Normally with cancer, by the time you're symptomatic, that's farther down the line. But what are the symptoms?
So the symptoms, unfortunately, of lung cancer can sometimes be none. The closer a lung cancer is to a main breathing tube, a bronchial tube, then maybe some symptoms of cough, congestion, coughing up bloody mucus. Tiredness and fatigue in general can be symptoms of lung cancer, but unfortunately lung cancer is very often diagnosed inadvertently. Somebody gets in a car wreck, they go to an emergency room, they get a CAT scan, and lo and behold, there it is.
Oh, wow.
So therefore, screening and preventative measures are really a big focus in the field of lung cancer.
I want to talk more about the screening because we hear about mammograms and colon cancer screening. There is lung cancer screening.
Correct. And with this being breast cancer awareness, one of the big analogies of lung cancer screening is nobody hesitates to say, go get a mammogram. Sure, I'll be there tomorrow morning. But with respect to lung cancer, their recommendations are anybody past the age of 50 with certain prerequisites, smoking history, et cetera, should get a low-dose CAT scan. It's a CAT scan that just takes a few minutes without any IV injections and very low-dose radiation. And it's recommended that it be done yearly to help detect an early cancer, because the earlier we can diagnose a cancer, the much greater probability that we have of survivalship or cure.
Yeah, and ultimately that is the goal. And we should also remind people that a diagnosis doesn't mean the worst.
Correct. And an early diagnosis is sometimes a blessing rather than diagnosing something very end stage. So as terrifying it can be for me to tell somebody, hey, I'm going to scan your lungs to check for cancer, it is the appropriate thing to do. And if we catch it early, that's when I usually say, hey, this is a terrible diagnosis, but good news, we've caught this early, we have ways of diagnosing it and hopefully providing a cure.
That has got to be a hard conversation for you to have. What persuaded you or inspired you to go into your profession?
I found the field of pulmonary medicine very dynamic, very broad, ranging from cough, bronchitis, asthma, allergies, all the way to the advanced lung cancer diseases. And since I got here with the development of new technology for us to diagnose lung cancer, robotic bronchoscopies that we have at the infirmary, it has just grown tremendously in my practice and become a very large part of what I do.
Awesome. Well, we are grateful for you and the services provided. Thank you for stopping by.
My pleasure.